What defines an atypical mole? Imagine spotting a mole on your skin that looks a little different from the usual ones. That's often what prompts concern and a closer look. An atypical mole, also called a dysplastic nevus, is a mole that stands out because of its size, shape, color, and microscopic features, but it is still benign or non-cancerous. These moles are important to recognize because they can resemble melanoma, the most serious type of skin cancer, which makes monitoring essential. Typically, atypical moles are larger than common moles, often over 5 or 6 millimeters in diameter. Some can be bigger, especially in cases of atypical mole syndrome. Their borders are usually irregular or blurry, unlike the smooth, round edges seen in normal moles. The color within these moles can vary widely, including shades of brown, tan, pink, or even lighter or darker patches that are unevenly distributed. They tend to be asymmetrical, meaning one side does not mirror the other, which can be a warning sign. The surface of an atypical mole can be flat, raised, or a combination of both. Sometimes, these moles change over time, growing larger, changing shape or color, or developing symptoms like itching or bleeding. These changes can be signs that the mole needs further evaluation. Under the microscope, atypical moles show disorganized structures and abnormal pigment-producing cells called melanocytes. The level of abnormality can range from mild to severe. Severe atypia is more concerning because it may indicate a higher risk of developing into melanoma. Doctors often use the ABCDE rule to identify suspicious moles. This stands for asymmetry, border irregularity, color variation, diameter larger than 6 millimeters, and evolution or change over time. If a mole exhibits any of these features, especially if it is changing or looks different from your other moles, a healthcare professional may recommend a biopsy. This involves removing part or all of the mole for microscopic examination to rule out cancer. People with many atypical moles, especially those with a family history of melanoma, are at increased risk. When someone has more than 50 or even 100 atypical moles, they may be diagnosed with atypical mole syndrome or familial atypical multiple mole melanoma syndrome, which carries a higher chance of developing melanoma. From a skin health perspective, regular monitoring of moles is vital. Professional skin screenings, including mole mapping technology, can help track changes over time. Mole mapping involves taking detailed photographs of your moles and comparing them during follow-up visits to catch any early signs of change. Protecting your skin by reducing sun exposure and avoiding tanning beds also plays a key role in lowering melanoma risk. In summary, an atypical mole is characterized by its larger size, irregular borders, varied colors, asymmetry, and potential for change. Microscopically, it shows abnormal melanocyte features. While most atypical moles do not turn into cancer, their presence indicates a higher risk for melanoma, making regular checkups, vigilant self-examination, and protective skin habits essential. Always consult a healthcare professional for personalized advice and assessment to ensure your skin stays healthy.